Good evening, everyone. Welcome and thank you very much for joining us today, and we hope that you all are doing well. I'm Dr. Shagun Bindlish. I'm an internal medicine physician and diabetes specialist, and I practice here in Dublin. I have been living in California and working here for past 4 years. So COVID-19 rarely has the threat of a disease occupied so much of our thinking. For weeks, almost every newspaper on its front page, TV, radio programs, and other social media have back-to-back coverage on latest death tolls, frightening statistics, practical advice, gallows humor. In this condition, we have three competing forces shaping up our decision, since there is still increased risk of infection going forward, given we don't have any vaccine yet. The three forces are health, economy, and government policies. As government is trying to revitalize the economy, the purpose of today's talk is to address some of the common concerns that we all have and try to work as a community to implement safe transition to next phase of reopening California.
Yes, Shagun, we all want things to go back to BC era before COVID time. Good evening, everybody. I'm Dr. Priti Parekh. I'm an internal medicine and obesity medicine physician. I've created 4 Wheels of Health model and a YouTube channel to share information that impacts people's life, people's health. I and Shagun will be your hosts today, and we have amazing guests. Shagun, can we start with their introductions?
Yes. We are honored to have our 2 esteemed guest speakers today, and they're one of our community leaders, Assembly member Rebecca Bauer-Kahan, and Dublin's Vice Mayor, I think we all know him, Mr. Arun Goel. Thank you very much for joining us today, and welcome. I would like to start with introduction of Assemblywoman Rebecca Bauer-Kahan. I think we all know her district, but she is serving this District 16, and she was elected in 2018. The district includes the community of Dublin, Lafayette, Livermore, Orinda, Pleasanton, Sandermont, Walnut Creek, Danville, Alamo, and Moraga. Rebecca is an accomplished attorney, environmental advocate, community volunteer, law professor, and a Bay Area native. She has also served on a number of boards and committees, and currently a chair of the Select Committee on Women's Reproductive Health, and also a member of Environmental Law and Toxicology Committee. Again, I would like to her to add anything if she would like to. I know this is quite brief, but I know we have a lot of accomplishments, and we have just squeezed the introduction in small words.
Oh no, thank you. I mean, my most important job is as the mom of my 3 kids, and then second is of course being your Assemblywoman. I love both of those jobs. So thank you for having me.
Priti, can you introduce?
Yes. So our second guest, Arun Goel, is the Vice Mayor of the City of Dublin. Arun was elected to office in 2016, served on the Planning Commission for 4 years, and he's a civil engineer with almost 25 years of experience in highway, airport, and intelligent transportation systems. With expertise in project delivery, Arun uses his professional experience as a leader for the City of Dublin and the region. Arun, Dublin is very lucky to have you as the Vice Mayor. Welcome.
Thank you very much for having me, and it's quite an honor to serve the City of Dublin.
Thank you. And before we move on, some housekeeping items. Audio video have been disabled for the audience. If you have any questions or comments, you can put those in the Q&A box. And towards the end, we'll get through as many questions as time allows. Okay, let's get started. Assemblymember Rebecca, this question's for you. The COVID-19 pandemic has fundamentally changed the landscape of education. You've said that in your talks and on your social media posts. Your bill, AB 2626, moved out of Assembly's Committee on Revenue and Taxation with unanimous bipartisan support. Congratulations.
Thank you.
And it was quite an eye-opener for me. Can you tell us more about this?
Yeah, so as you heard, I have 3 children. So I am doing distance learning alongside all the parents out there. My kids are going into 1st, 3rd, and 5th. And so I firsthand understand the difficulties that come with everything that has changed in the landscape of education. But we had initially actually introduced AB 2626 in January in partnership with one of our Lafayette school board members. It was one of his ideas. He came to us and said, you know what, schools pay sales taxes when we are a government run entity basically. And then that goes back to the taxes and we get 40% of that back. Why do we pay sales taxes? And we thought, well, that's an interesting thing. And we looked into it, and there are any states that have exempted schools from sales tax. And so we introduced a bill that would have entirely exempted schools from sales and use taxes. That bill was not getting the support we needed. And then when COVID-19 hit and schools had to immediately shift to distance learning, a lot came out about the digital divide that exists between students. There's 1.5 million students who don't have access because of the digital, or 1.2 million students, excuse me, that don't have broadband or computer and a way to access distance learning. And just recently it came out that at least 150,000 students need a laptop or a device in order to do their learning. And that's unconscionable. One of our promises here in the US and in California is that every student has access to a public education. And currently that isn't true because those students don't have the basic devices they need to connect with their teachers in their schools. And so we decided to pivot the bill to focus on those devices that they needed, the hotspots, the laptops, the tablets that are needed just to get into your Zoom with your teacher, watch the video, or do your math assignment. And so we amended the bill, and as a result, the chair of the Assembly Rev and Tax, Assemblymember Burke, joined me as a co-author on the bill, which was a huge boon of support because she's the chair of the committee. And we presented it, and like you said, we got out 10-0 with bipartisan support, which I was really proud of because together as a state, this isn't a partisan issue. Every student needs to be able to access education, and we're in a time where that means something different. So we hope it will be a little bit of relief for our schools. Actually, our witnesses at the hearing were 2 of our Dublin school board members. Amy Miller and Megan Rouse came and spoke about the immense cost to Dublin schools to try to get people the devices and the hotspots they needed. And just this help would have really made a difference in their budget and given them at least another chunk of money to spend. So we're hopeful it'll keep moving.
Great, that's such a great initiative.
Thank you.
All right, moving on to the second question. California residents have been doing great in staying home and saving lives since the start of our shelter in place in March. As we progress towards reopening, can you please throw some light on what businesses are considered as low risk and will be reopening first?
Yeah, so you've seen most of California has moved into phase 2. And that started with the reopening of curbside retail, right? So today I got to go pick up my kids' end of the year books from our local bookstore right out front. I did my curbside pickup, and now all businesses can do that. We also saw outdoor businesses like nurseries, for example, opening up so that people can shop in them as they did before the pandemic, because we know from the public health studies that it's much more low risk to be outside in one of these facilities. So opening up more low risk activities, allowing our economy to continue to operate as much as possible while keeping our community safe, which is always the most important thing. And I want to give a big shout out to both of you as physicians in our community. You are our heroes right now. Thank you and all of your colleagues. Because it really is, safety will always come first, but our economy is critical and we need to do everything we can to keep it moving. And so, some of the things that we've said maybe are later in the opening will be hair salons, nail salons, things where you are in close contact with someone inside for an extended period of time, we know is a riskier proposition than in a retail store where you can keep your distance, maybe you're in and out pretty quickly. And so, in phase 2, we also saw the reopening of our hospitals and our healthcare providers for non-emergency or elective procedures, which is really critical. I know that sometimes we call these things elective procedures, but, I have someone in my life who is needing, a cancer prevention surgery that's considered elective because they are not positive this time, it is really critical. And so enabling those things to move, colonoscopies and mammograms that you should all be getting to keep yourself healthy. You can go out and do those things again. Dentists are reopening, so you know, we don't know how long we're going to be like this. Get your teeth cleaned. So really looking at the risk of the activity and how much we can reopen and keep us safe. But one of the things that I think the Bay Area has done really well and the state is doing really well is watching and seeing, right? So opening just a little bit, waiting 2 weeks, which we know is the incubation period, and saying, okay, nothing happened, and being able to reopen a little bit more. And the indicators that the county has that they're following are really key in helping us know if what we're doing is keeping everyone safe and really making sure that our hospital systems can deal with the number of people that have COVID-19. We can't vanquish it at this point, but we can maintain that curve so everyone gets the treatment they need. That's really the critical goal that the government is trying to achieve.
This question is for you, Arun. I would like to say, what are some of the changes you have noticed at the city level?
So at the city level, relative to the opening, you know, Assemblywoman has indicated accurately, we're basically following in line with the way Alameda County is pursuing and proceeding. So all of the regulations, all of the processes. So like in that first portion, we did that curbside restaurant pickup. And really what we're doing is working to inform the businesses and keep them educated on what does the new guidances mean. So later on this week, we're supposed to hear additional guidance on summer camps. We're supposed to hear some guidance on the daycare facilities. And with that, what we'll do is continue to inform and educate and help our local businesses understand and open up so that they can try to make up for lost time. When I say lost time, lost revenue. You know, one of the things that we did trying to really help bridge that gap is we introduced a micro loan. And it for application on Tuesday, within half an hour, it was oversubscribed, twice as much as what we had budgeted. And 70% of that was focused on restaurants. So you can see that our businesses are staying informed, they are being educated, they are understanding where they can go. And if they don't know it, they know where to reach out to. And that's part of our process, is to really make sure our businesses are informed and educated and that they're not feeling left on an island.
Yeah.
Thank you very much.
Yeah, important points. And Rebecca, as you mentioned that, you know, we're going to be doing this slowly, little by little. And that's so important because we're not out of the woods yet. You know, we're still seeing cases, we're still hospitalizing patients. And so I know you covered some of this, but as some of these businesses open, especially restaurants and daycare centers, how do we ensure safety for all? Do they have any guidelines they need to follow?
Yeah, so that's a great question. So one of the things that I think the state has been doing that has been really helpful is as things are allowed to open, they release guidelines on how they can do that safely. So what kind of protective equipment is required for restaurants, example, the masks that servers need to wear, distancing of tables. So because certain counties are moving faster than other counties where we have less cases. And so restaurants are actually doing dine-in in some parts of the state. And hopefully we'll be there soon. But making sure that stores have that guidance about having hand sanitizer at the register, the things that we need to make sure that we're reducing the risk of people catching this virus. And I think one of the critical points, though, is the county's incredible indicators. I know I talked about it before, I'm going to talk about it again, because I really think it's one of, I mean, so the Bay Area, just so everyone knows, is the first in the nation to have very clear trackable indicators to talk about when we feel comfortable reopening and when we know we've gone too far. And those indicators are very focused on the things we need to keep people healthy. So it's whether our hospitalization numbers are flat or decreasing, right? We trust our hospitalization numbers the most because our testing numbers have been all over the map. And our hospital numbers are very, you know, the number of people that show up and test positive has been a consistent number. So we know that that's an accurate read on what's happening in the community. Making sure that no more than 50% of our non-surge hospital beds, so our regular hospital beds, are full. So we know we have capacity if there is a surge, right? That's critical. We've seen in other parts of the country where there isn't the ability to serve people in hospital beds. We always want to have that capacity available if something happens, because the incubation period is 14 days, right? So by the time we've done something, we need to be ahead and ready to serve those people. And then that all of our hospitals have 30 days of PPE available, protective equipment, so that if we have a surge, we know that our frontline providers will be protected. At the beginning of this, we weren't able to do that, and it was heart-wrenching and it was difficult, and we don't want to get back to that place. And so making sure we maintain that 30-day supply to protect our frontline workers is really critical. And then the last two indicators, which are really important, is our ability to test. So making sure we have enough testing available so we know what's happening in the community before people show up in our hospital, and then that we have the ability to track and trace those people who are testing positive. So we have to have the ability to trace 90% of our positive tests. So for 90% of the people who are testing positive at our sites, we're able to say to them, where have you been? Who have you talked to? How do we quarantine those people so that there's not an additional spread? And so making sure that we're tracking all of those indicators so that we know we can treat everyone in our hospital setting that needs it, and that we're not surging in an unpredictable way. We have the testing capacity, we know what's happening, and to be ahead of it, because that is what has saved so many lives in the Bay Area, is that we have been ahead of it. And you know, the numbers coming out of UCSF are astounding, you know, saying that we've saved over 40,000 lives with the measures we've taken, and every one of those lives matters. And so we need to continue to be vigilant in protecting our residents.
Mm-hmm. And Arun, what do you think at a city level? Are we doing anything different? And if you have any message to the community as we reopen?
So again, as the Assemblywoman said, you know, we're really making sure we fall in line and we follow the health orders coming out from Alameda County. She has a broader district and we have a more focused response. Mm-hmm. The good thing that we've done in the Tri-Valley is the three cities came together and made sure we funded the testing at the Alameda County Fairgrounds. And that was a real big important step to make sure that we were able to test and track. Mm-hmm. Things that we're seeing though is at Dublin, we've been pretty flat. Our hotspot obviously is the jail, but that's being tracked separately now. The other thing that we've been noticing is we're fairly flat. We've been at around 26 positive cases, and that's kind of a good sign that our community is understanding and embracing the physical distancing. What we've also seen is a lot of community-based organizations and nonprofits really coming together to make sure that they're addressing the essential needs. So the essential workers out at the grocery stores, do they have the necessary PPE and shields? The restaurants, because what we're trying to do is also alleviate the burden of the financial needs that they're already having to absorb. Payroll, they're having to absorb their rent. There's no real relief coming to them at this point from those big magnitude of checks that they're having to release. So that is one of the other key elements. What we're seeing is we're not hearing outside of, I think there was one grocery store that was a bigger chain grocery store that had a single positive case. We haven't heard much more than that. So that's a lot of good signals that we're doing what we need to. Our farmers market is working out really well. That was something I couldn't even embrace initially. I was like, oh, it's too soon. But you know, I think what we need to do is start turning to a positive messaging, is share some of the good news. And the good news is we are flat. We are doing the right things. We are maintaining physical distancing, and everybody is appreciating it. I mean, I've had a family member, one in the East Coast, that younger than me passed away. We had another one in internationally, younger than me, my niece, okay, tested positive and recovering. So what I'm trying to say really is it's more than lip service. It is a very real pandemic. We all need to take it serious. We are getting frustrated. We are wanting to loosen up a little bit, and we are wanting to enjoy. And I think the state and the county levels are doing the right things. And I'm fully going to embrace that.
Thank you. Thank you, Rebecca. Thank you, Arun, for your insights and information. Shagun?
Yeah. So there is a wave of bankruptcy and unemployment, and unemployment statistics has been rising, and that is creating a lot of fear in people's mind. as they're losing the insurance, medical care, benefits, etc. So do you have any federal or state level like policies or plan in place in future to help them?
Yeah, I mean, as you mentioned, and as the Vice Mayor mentioned as well, and talking about the way that small businesses are struggling, and small businesses are our biggest employer in the state. They're really an important part of our economy. And restaurants and these local businesses that have not been able to operate at full capacity are struggling and are laying people off. And we are seeing that in the number of, we went from record low unemployment before the pandemic to unemployment numbers that we haven't seen in modern history. It is really devastating, and my office is working around the clock to help support our local community members who are trying to seek assistance from the state. But yes, there's a lot of relief coming from the state and from the federal government on unemployment. So you have your traditional unemployment insurance that is available for folks who are lose their job, or I should add, who are underemployed. So if you lose your hours, maybe you've been cut in half, you actually may be eligible for unemployment. So you don't have to entirely lose your job in order to get those benefits. And then the federal government in the CARES Act extended that to apply to people who weren't traditionally eligible, right? So independent contractors, business owners, people who traditionally aren't eligible for unemployment are under the CARES Act and can get that. It's called Pandemic Unemployment Assistance, but is done also through EDD, state EDD. And so all of those people are able to get that. We've extended the time period that they can get unemployment for. And there's also an additional federal benefit to make those benefits even more generous. So there's a lot that's coming our way because we know that right now people are struggling and we want to make sure we support them and keep them housed and fed. And there's a lot the government is doing. But I would be remiss if I didn't mention, as the Vice Mayor mentioned, our incredible nonprofits. So the government is doing a lot, but so are our community partners. I mean, the food bank of Alameda County has done incredible work in making sure people have access to food, making it available at all of our school sites. I know Dublin has done an incredible job of this, of making sure that if you come to show up to get a free and reduced meal, which now, by the way, for anyone who needs it, you are eligible. You don't have to qualify. If you show up at one of those school sites, you will get meals for your children. We want children to be fed. And now the Alameda County Food Bank is handing you a bag of groceries to make sure that you're well fed. And so, you know, our housing partners and everyone is really working to make sure people remain housed, fed, and taken care of. And also the programs coming out, the loans are really critical to keep our small businesses. And I really want to give a huge shout out to Dublin for that small business loan that they did. It's really a unique effort by a city. And it's phenomenal because the more we can keep our small businesses open and running, we keep people employed. And that's what we want. And those they are really the gem of our community. We want to keep them going. So thank you to the city for being such a great partner in that. But there's also the other piece of assistance was that there was a federal loan called the PPP loan that was available to businesses to apply for, that if they used 75% of that loan to pay salaries, it was forgiven. And the goal of that was we wanted to give them money and make sure they kept people employed with that money. And so by forgiving that piece of the loan, it really was an incentive to keep people on the payroll during this hard time. So a lot was done to get people, to ensure people would stay employed and support those that aren't.
So if I may just add to what the Assemblywoman has also added, you know, at the state level, they also have this program called Great Plates. And the program is really focused on seniors. And a lot of times people forget about this generation that sits out there that is actually in dire need. These meals are really dedicated to the ages 65 and above, or if severely at risk, 60 and above. Alameda County is doing that. I know that the city has also supported efforts in making sure our seniors here through Meals for Wheels are getting the necessary support as well. So all of this combined, you're starting to see a complete ecosystem, right? Where we need to really focus in on the dire needs of people. You know, like Project Room Key, you know, the governor's done a really good job of saying, hey, you know, the essential workers, some of them are commuting from far in, they don't know where to stay, they're not getting the rest. We have to make sure we take care of them. Same thing for the homeless. You know, there's a nonprofit that I work with that is focused on really giving face masks to the homeless, something that you wouldn't necessarily consider out the gate, but they're actually at risk. And so making sure that they also have shelter if they test positive. the state has actually focused in and honed in on a lot of good components. And one of the things about the businesses coming back, where the governor's kind of really focused on is his silos. You know, he's having these meetings regularly with the different focus groups to make sure that all those interests are being accommodated. So when the guidance comes out, they're really relevant and focused. So hats off to the governor and hats off to the state. And of course, the Assemblywoman, who's very much making sure that we're all taken care of and that we're attending to our dire needs.
Yeah, this is all very
Sounds
encouraging.
good.
Yeah.
Yeah.
And yeah, I mean, you're right, Rebecca. This, we're in this together. All of us are contributing, but we cannot do this without help from you guys. So thank you. Okay. Moving on to this next question, Rebecca. This one's for you. While education is very important, safety is a priority too. Parents are anxious to know if there's any plan in place for next academic year, and I'm sure you can relate to this as a parent as well.
So true. If you watch some of my town halls with some of our superintendents of schools, when they say things aren't opening, I take it personally because I'm dealing with my wonderful children with me all day as well. So yes, we all want school to return, and we all, as parents, our kids' safety is our #1 priority, right? Their learning is really critical, but we want them to be safe. And so what the Alameda County Superintendent of Schools has said is that they have the time now to prepare, right? When initially this virus hit and we were all sort of taken a little bit quickly, that we didn't have a way to move things as quickly as we needed to keep children safe. But given the months we now have to figure it out, that they are optimistic that we will find a way to reopen. I know the state superintendent of school is about to put out guidelines for how to do that safely. The CDC has put out some guidelines on what they think needs to happen in our schools for it to be done safely. I've spoken with some of the local school districts in the Tri-Valley, and I know they're looking at hybrid models, and looking at, can we continue to support? Because the other thing is, although some parents may decide that they feel comfortable, there may be kids with underlying conditions whose parents make a different choice, and that should be okay too. And so making sure we support all parents in the decisions they make, and again, as we talked about earlier, provide all students with the educational opportunities, no matter what the circumstances are. And we also need to be realistic. We may reopen in the fall, and many experts say that we could see another wave of this, and be prepared to dial it back and be able to continue to educate our students. So it is a local decision. So each district will make their own decisions on what they want to see. And the state is able to say no to everybody, but we have not done that. Actually, the schools made their own choices about whether or not, when and how to close. And we did have a couple rural school districts that stayed open throughout this whole thing. And it was places where we didn't have hotspots, and it was safe for them to do so. And the state allowed that. So we have not taken the step of saying schools cannot stay open or that they need to close. And so likely this will be a local decision, and every district will decide what and how it's safe. But we will be providing clear guidance on how you can do it safely and what that looks like for students. Just like we are with camps, as you heard the Vice Mayor mention, our cities run some of our best camps. I'm a huge purveyor of my city's camps. And we've been very clear in, they need to be groups that public health officials have said less than 12 kids. Those have to be stable groups. You can't have kids intermingling, and really thinking about how do we keep the spread from happening if something were to happen. So continuing to provide the guidance to allow our school districts to do what they do best, which is educate our kids.
Yeah, but when it comes to, and I agree completely with what you just said, but when it comes to kids, it's like we don't want to take a chance, even a small chance. I've been on DUSD Wellness Committee, and a lot of parents, they come to me with questions and concerns, and they're concerned that even the hybrid model may not be foolproof.
Yeah, and I think it's critical. One of the conversations we're having, as many of you probably know, the way we fund schools is attendance. Right? So if your kid shows up, you get funded. And if they don't, the school doesn't get funded. And so one of the things we're really looking at is making sure that we don't do that next year, because we want to support making sure that parents and school districts, first of all, if your kid is not well, then we want them not to show up at school. That's one of the important parts, keeping everyone safe. But also that parents are safe, are able to make those decisions, and that we're providing educational opportunities for parents who don't feel like it's the right choice for them. And I think that's right. I think none of us want to take a chance, and but that people are, I do anticipate parents making different decisions. We have different risk tolerance, and that's okay too. And again, it's our job, I believe, to support all of those choices of parents, and provide quality education to every student, no matter their circumstance.
Thank you.
So another question arises that even though our healthcare capacity is steady and since we have been testing a lot, do we think what happens if the surge happens? Do we have any plans in case we need to dial back?
Yeah, so I think it's the governor who said that this will be more like a dimmer switch than an on-off switch, right? So we're not just going to open it up and say, let's go. And you've seen that, right? I mean, we opened retail and manufacturing, but retail only for curbside in the first instance. We're hopeful we can get to a place where retail is open in a more meaningful way soon. But it's been really like a dimmer switch, right? And there's absolutely the intention, and we've seen this, we've not had to do it in California, but we've seen this around the world, where countries have opened and they've seen things go the wrong direction and they've had to dial it back. And we anticipate that may happen. We're hopeful that if we give good guidance and people follow our guidance, as the Vice Mayor said, it's critical that everyone be educated, yep, that we will be able to continue to open. But yes, you know, it's a dimmer switch and you can turn that dimmer back, and we may have to because we don't want to get overwhelmed. We don't want to see happen elsewhere happen here. We want to make sure we can serve all of our patients in our hospitals and have ventilator capacity for everybody who needs it. That is critical, and it is something we are going to continue to be vigilant about.
And I think one of the key pieces inside of there is the tracing and the tracking again, especially as they hone in on the verticals. You know, I'm hearing a lot about, you know, matter of fact, I heard one circumstance today. 2 people tested positive. Because of the sign in, sign out process and the tracking of it, they honed in and said, okay, 13 people that were around these 2 individuals had contacts. Therefore, all 13 of you are on quarantine until you can show a COVID-19 test that indicates you're negative. You know, I think that's the scale up, scale down. I'm pretty sure what's going to also happen as they start to see, if we do, unfortunately, see some more positive cases, they're going to focus in on those different silos, and they're going to be learned lessons. Because one thing that the governor and his entire staff have done is very methodical, and it's very, very scientific. It's almost like going back to biology class and introducing a control group. We introduce one change, see what happens. Something happens, we go ahead and make a modification. So that's why, you know, like the salons and stuff, they're going to be a little further out. Why? Because they're trying to really make sure that both the organization that's providing the service can wear the face mask, as well as the patron. And that's going to be critical until they understand what are the impacts and what are the hotspots, right? You know, you heard the governor talk about nail salons. He didn't want to really focus on it, but what it becomes is that vertical of where they learn. And that's what they're trying to take some of those learning lessons and sharing it out.
I think that's right. Yeah, and one of the things that the Vice Mayor mentioned, which is one of the places we've been struggling the most, right? He said the hotspot in Dublin is the jail. Congregate care facilities where people are in close contact has been the place we have struggled the most throughout the state. And that's true in Alameda County and Contra Costa County as well. And so, you know, we are focusing on testing those individuals bi-weekly, right? I mean, we're doing more for those facilities because we know, first of all, they tend to be vulnerable populations. And secondly, it is really a hotspot in a place where it's hard to control a spread. And so, and we've seen that, and we've seen the mortality rates be just unacceptable. And so, you know, putting our testing resources there and making sure our hospitals are partnering with them. And so, like the Vice Mayor said, making sure we have a really good understanding of what is happening, where it is happening, and how we can do our best to control it and to support those communities.
Sure. Thank you very much for wonderful session of question and answers. I would like to open the stage now for our guest community. Please feel free to type in your questions in the chat box.
Meantime, I have a couple here. So I have one question. What kind of public services will be available at the city offices after we reopen? So I guess this one's for you, Arun.
Can you say that again? What kind of public services
will be available at the city offices after we reopen?
So one thing that we are talking about, we've never really shut down per se. Our staff has made sure that our services are maintained. But I think one of the critical things that are really on people's mind as we approach summer is our recreation. So we've gone to a virtual recreation solution. The other thing that we've done is we've started to introduce the elements for essential workers, so like the daycare centers and things of that nature. As far as actually in the building at City Hall, we are going to be making sure that we're checking everybody coming in, that temperature check, sign in, sign out, because we want to keep our staff safe as well as our public. So it's a two-way street, but we want to make sure that we're not falling behind on critical elements. So for instance, like people who needed permits, the permits were being issued, especially as soon as we came out of that phase one, and certain construction type projects were being allowed. So I think it's going to be an evolving process, and really what we want to do is make sure that our patrons, our city is served properly, and that we're not putting anybody at risk, and we don't have to become the headline city that says, hey, we went and did something too aggressively and now we got to dial it way back. So I'm going to inch up, and we're going to keep on following the county guidelines and state guidelines, making sure we're adhering and making sure we're proceeding cautiously.
So there is a question from the community about the school. They're asking if we going to screen the kids more frequently when they go to summer camps, or even if the school is a hybrid model in future. Have we have any such type of plan in place?
So I don't think we have plans yet about what that will look like. As I said, the state superintendent of schools is going to release his guidelines, and we'll see whether temperature checks are a part of that. We know that, I mean, as you heard the vice mayors talk about City Hall, the same is true at the Capitol. If you come to give testimony, the nurse is there doing a temperature check. So it is something that's becoming the norm in the state, and I think it's a positive thing. So we'll see. I don't know the answer to that. I was on a call with some school board members the other day in which they told me that their school board is considering it, and they were looking for support in getting thermometers. So I think it will be potentially in the recommendations, but we will yet to see, and we will work to support school districts that want to do it.
And I think for summer camps, you know, we're going to be waiting for the guidelines and adhering to that. But, you know, as the Assemblywoman's indicating, you know, there's a lot of things that have worked. And, you know, we're testing it out with those small industries that went back. You know, you are checking the temperatures, you are finding out who and who's not. That way, if something does happen, you have a mechanism that will allow you to crawl back and say, okay, these individuals were impacted. This location. You got to remember, we got some HEPA laws and stuff like that we've got to adhere. So you're never going to know the isolated one individual. But what you are going to know is if you attended, who it was, you know, like not who, but like when it was, and the group that it was part of. And then they can focus in and make sure they get checked, they can quarantine as appropriate, and then come back in to play.
And this next question is there a pressure to move to phase 3 sooner than expected? Most of Bay Area counties went to phase 2 a couple of weeks back, and now there is talk on phase 3.
So one of the fascinating things about all of this, and many people don't know, is that our public health officers are completely independent of politicians. So we meet with them, we talk to them, and we have no control. They make their decisions, and there's no vote. The County Board of Soups does not vote on the public health orders. They are completely based on what our public health officers believe is in the best interest of the community based on the science and data available. So community, I don't know that I'm feeling community pressure, but it's not going to weigh in, let me tell you. I know these public health officers, and they are going to do what they think is safe, not what we are eager to do. And I think that I'm aware, and I live in this community, as do all of you, that there's fatigue. This has been hard. Staying home is not easy. Whether you're alone and you're feeling lonely, or you're in a house with 3 children, this isn't easy. And so we are very aware of that. And so I think there's been efforts to make sure people understand they can get out and recreate, that we are allowing ways for people to be healthy and take care of their mental health, but also making sure that nothing will force us to do something that is unsafe. And again, as you've heard from both of us, economic recovery is at the front of our minds. We also know that there are health impacts to poverty, right? So anytime we hit the economy with this, there's health impacts there too. There are a lot of considerations that go into it. And so making sure that we are taking all of that into consideration. And I know that the public health officers are, they're so thoughtful and they will do what is in the best interest of the community, but public pressure doesn't actually have any impact because they're not, there's no political input into what the decisions they make. It is all science-based.
Another question here is about the city cleaning. So how is the city cleaning and keeping up with the hygiene in common public places like kids' play structure, opening the parks or malls, for example? Are we having any plan in place for that?
Well, currently, as many of you guys know, our parks are closed. The parks are the facilities like the play structures, and they're ribboned off. The basketball hoops are removed. That was all part of the initial executive order that came our way. As of right now, there is no real structured plan that we understand, right? So we're waiting for the guidance. But if you kind of just pause back and say, let's look at a play structure. What is happening with those kids? They're touching everything. Mm-hmm. And what does that mean has to happen? Do they need to sanitize better? Do they need to wipe down? Or are kids not as susceptible to this disease? And I think it's a learning process. So I really don't know how to answer that question in any better way. As far as in our facilities, like our city hall, there are more deep cleaning going on, and we are spending more money for that, and we're making plans as appropriate for that. Again, safety is going to be our essential thing for our community here. We don't want to become that hotspot, and we want to do what's prudently correct. We want to follow what the county is guiding us and what the state is guiding us as well.
So, I don't see any more questions. Would you like to please address community final take-home message?
I can start. So I just want to say thank you to the community. I mean, this has been a tough 3 months, and it will continue to be tough as we reopen and as we face what the future holds until we have true treatment and vaccination for this virus. But this community has shown in a way that I knew we could, but we've really seen it. People coming together, as you heard from the Vice Mayor, and providing masks to the homeless and hand sanitizer, and providing leftover masks from the fires to frontline workers, and food to those who need it, and willing to drive for Meals on Wheels to make sure our seniors are fed. And just left and right, our community has stepped up to really, really support one another to get through this. And that has been the silver lining to all of this, is all of you and what you've done. And as I mentioned earlier, UCSF is saying that we have saved tens of thousands of lives by staying home. And it's the first time in my life that I've had the opportunity to save tens of thousands of lives. And I bet that's true for most of you. So I want to thank you for doing that, because I know it's hard. I know it's not easy. And it matters. And you are really doing the right thing. So thank you. We are aware of all the challenges, be it unemployment or as a small business owner, keeping your doors open, or distance learning. But we are here to support you. Please reach out to my office if you need any support with any state services or anything else. We're here to direct you and help you and open, as usual, virtually. All my staff is working from home, but they are available by phone or email. So just thank you for being the community that I knew you could be. And you know, I look forward to getting to the other side of this, and we will get through it together. So thank you. And thank you for having me. This has been a really fun conversation. And it's been fun to join you, Vice Mayor, and talk about these issues.
Sure, thank you. Arun, how about you?
Well, first of all, the Assemblywoman said it best. Our community has really shown up. They've pulled energy and focused on the dire responsibility that is fundamental, that many would have thought is lost in today's era. You know, if you look at the young children that are coming through the high school, you know, you have sophomores, you have juniors, you have seniors, and they're all coming up with innovative solutions. They're saying, hey, let's not wait for somebody to come with a solution. Let's identify and let's really try to focus. I had a parent reach out to me, says, I have a bunch of high schoolers that are looking at how to support businesses and where are the gaps. And you know what? They started saying, hey, do we need to support maybe their marketing efforts? And it was like, aha. And they're taking certain things and starting to run with it. And so what we found, and I think to the Assemblywoman's point, is people are coming together. They're uniting, and they're showing that we are all one and that we will win it together because we're going to do it correctly. And if we have to dial it back, I think people are going to respect that. I think really what's to be said here is sessions like this, really engaging with the public and helping them understand, like the Assemblywoman said, the health orders that are coming are non-political, right? We get heat as local people, local officials saying, open up already. You aren't helping us. You're making us go broke. It's not our decision. But what is our decision is how we can support and what we can do to help them be informed and educated, help them know where the money is. The Assemblywoman has said, hey, if you've got something and you need to know, engage with us. That's how we have to do it. I think it's going to be a partnership. And I look forward to, the next levels that we do it and doing so successfully. And for that, I really just want to say to everyone, it is a real disease. It is a real issue. I've shared personal impacts on our family. There's others that have had the same. They may not be here in Dublin, but it is happening. And think about it. As a country, we climbed above 100,000 yesterday. That's a big number. It's the biggest international number. But if we look at what's happening at our state, we continue to move down. If you look at our rate cases in Alameda County, it's one of the lowest. And if you look at different cities, it's stabilized. Those are positive indicators that the leadership is leading us the right way. Thank you. Thank you for having me, an Assemblywoman. It's been a great pleasure to participate with you, and I look forward to more.
Thank you. Thank you, Assemblywoman. Thank you, Vice Mayor. Thank you for the wealth of information. Thank you for your time. It feels great to see a majority of the people do that part, helping each other. But I would like to say, as we prepare to reopen, please be conscious that the virus is still around. As physicians, we are still seeing positive cases, people are being hospitalized. And so I would like to remind everyone that we're still practicing social distancing. We're still wearing masks and washing hands when necessary, because these are our best defenses at present. A bit of precaution can go a long way. And I would like to say all storms do end, and this too shall pass, and we'll do it together. Shagun, you want to add?
Yes. First of all, I would like to thank you very much to our guest speakers of honor today for joining us from their busy time. Thank you very much for everybody who has joined us from the community today. Definitely this session was meant to educate you, help you, what is the plan as we are reopening California, and we will be hoping to do more sessions. But again, I would like to say our health is in our hands. We can do best if we all get together and just take all the precautions and help each other as a community with the right guidance and from CDC. That's the only way we can control this pandemic. Once again, thank you very much for joining us today.
Thank you.
Thank you both. That was a wonderful conversation. Good to see you all.
All right.
Very good to see you all. Thank you very much.
Thank you. Bye.
Thank you. Bye.
Bye, guys.